Bernard Health's mission is to be the world's most trusted advisor when it comes to helping people plan for their health care.
And so we got started about 11 years ago doing that. At first it was just Alex and I. Our first recurring expense was Salesforce.
We had grown from 1 user to 10 users to 20 users to 40 users. So what Salesforce was getting from us from a revenue standpoint was growing quite a bit every year.
So we built really the whole company in the spirit of, okay, well, if we're going to do that, how's it going to work in Salesforce? They wanted more money every year, right? We were getting our annual increases. Our billing terms were changing from, I think we started monthly to quarterly, or now they wanted us to pay annually.
But then they started adding and requiring that we purchase these other things that we didn't need. And so we'd have a renewal coming up, and then they'd say, oh, and we also are requiring that you buy X.
Our account manager ultimately came to us and said, you can't leave. You can't. You all are in like the top 3 or 4% of our users. Like the pain around moving will be really high. And so therefore you should pay us 18% more, not because we've done anything to improve the product or improve our customer service, but because of Wall Street. And so that's when we started evaluating and we learned about Zoho.
Zoho has very good documentation on its website on how to do a migration, which was really important for us because we had 10 years of data in our legacy CRM, right, in Salesforce. The main thing was making sure that the page layouts were right, that the processes were all going to be right in Zoho, and then it was as simple as downloading data out of Salesforce and uploading it into Zoho. Our estimated 5-year savings is well over $500,000, saving $100,000 in the first year.
So for us, we always think about opportunity costs. It's not like Alex and I are each making $45,000 more this year. It all comes into headcount for our team, and ultimately, now that we have a technology of our own, we can use that money to improve our technology for our down-end clients.
Of all the Zoho products, right now we're using Zoho CRM, Zoho Campaigns, Zoho Connect, and Zoho Desk.
Being able to have all the information that we have in Zoho CRM, so our account page is critical. Without it, I wouldn't be able to do my job. And then Zoho Desk, since we use that every day for incoming questions, we probably have 40 to 50 incoming tickets a day, which is really helpful for us to be able to keep track of, okay, what are the issues that are coming up, who's working on those, how quickly are we getting those resolved, making sure that we're getting timely responses back.
So really all of our workflows go through Zoho, and that's very helpful because if any of us, there are 3 people on my team, is out on vacation or in a meeting or somewhere else, we are able to view everything that's coming in. It's very easy for me as the team leader to prioritize the workflow.
Also, our people just feel better. It feels better to use Zoho. And when people say, well, how does it work better? It's a little bit hard to describe because you're just like, well, it just does. I mean, Zoho Connect, to just give an example, is something that has got a lot more functionality than what we had been used to.
I'm in a peer group of other organizations that are like ours. We kind of share best practices. And about 18 months ago, I'd told a few of those peers that we had worked with Salesforce, and then 6 months later learned that 3 of them went ahead and moved forward with Salesforce, and so it was a little anxious to tell them that, oh, actually we fired Salesforce, we've moved to Zoho, and now interestingly enough, those 3 are coming to me with the same frustrations that we had with Salesforce, and so they're wanting to learn more and more about Zoho. Absolutely, I would. It's like a Band-Aid, you got to rip it off, but I would definitely wholeheartedly move to Zoho again.